Hello, everybody. Good evening. Welcome to this nice, chilly June evening for us to all learn about electronic prescribing, update for GPs and practice managers. Oh, here we go. It's already kind of bung for me. Go away. Oh, there we go. That was a good start, everyone. I don't know why I've gone like that. Let's start again. Here we go. And how do I get this off my screen? There we go, just hide it down there. That'll do. Okay. I would just, Northwestern Melbourne Primary Health Network would like to acknowledge the peoples of the Kulin Nation as the traditional custodians of the land on which we're meeting today. We recognise their continuing connection to the land, waters and culture and would like to pay our respects to elders past, present and emerging. At the moment, we are all going through this nice chilly evening, through coming together and learning a little bit about e-prescribing, which has been a very hot topic, though we do have some other interesting things happening at the PHN. We have lots of education and training sessions coming up. We have another electronic prescribing update for pharmacists coming up on Thursday, NDIS training, and you can see there's a few other things on there, telehealth and pathology items in Cat 4 for the COVID-19 and so on. Or you can always find out what we have happening at the PHN by visiting our webpage where you'll see all of our education and training sessions under events. We also have Think Tank. We invite everybody to join our Think Tank and be the first to hear of opportunities to get involved with the PHN. We have lots of different general practice engagement that happens. Anyone that has got any interest or special interest, e.g. diabetes, pediatrics, mental health, we welcome you to come along and just even have a go and just see how it all works. It's just getting together, collaborating for future PHN projects. COVID-19, the 4 S's, stay up to date, sign up, subscribe and save. This is, you know, we're all going through this COVID. Let's all remember that we're still in amongst it all and we haven't finished as yet. Just keeping safe, and the PHN will constantly be updating. Anyone that subscribes to our newsletters will be getting all our alerts as things progress and change with the COVID. During this period, we also have offered Health Direct to all general practice. It's a free platform for video conferencing in order to conduct telehealth consultations. This platform will be provided free to all general practices and specialists, I think, at the moment till the end of September, which is when the MBS items for telehealth cease. We also have health pathways. I hope everyone here has heard of health pathways. We have 750 pathways at the moment, which assist GPs to use at the point of care. If you would like to have an automatic login for your practice, so you don't need to use the username and password, contact the melbourne.healthpathways.org.au and we can actually organise a direct login for your practice. So today we have speakers Nicola Graham and April Burnett. Nicola is a provider of adoption lead with the Australian Digital Health Agency and has management experience in both medical practice and community pharmacy. Nicola previously worked for a primary health network in the delivery of practice support and digital health. April is a provider adoption lead at the Australian Digital Health Agency and has a background in public health and community pharmacy. April previously worked for a primary health network as well, where she supported the implementation of secure managing and My Health Record, I should say. Welcome, Nicola and April. And okay, are you there?
Yes, I am. Sorry, I just had to take myself off mute. So I just confirmed, can you see my screen?
I can see your screen.
Yep. Okay,
Yes.
perfect. Okay, so welcome everyone, and thank you for dialing in tonight. It's fantastic to have so many people on board this afternoon to learn more about preparing your practice for electronic prescriptions. The purpose of this evening is to introduce electronic prescriptions, and we will be providing an overview of the roadmap for delivery of this. Electronic prescriptions were already on the national agenda for 2020. However, the timeline for this has been accelerated in response to COVID-19. So we will be touching on the adjusted short-term priorities while also detailing the long-term solution. We will be exploring the features and benefits of this, including a case study demonstrating what electronic prescriptions may look like in your workflow. And further to this, we will be clarifying what you and your organisation needs in order to be ready for electronic prescriptions. So as you can see from the top banner in this slide here, electronic prescriptions is a component of the medicine safety pillar of the National Digital Health Strategy. The Department of Health and the Digital Health Agency have collaborated to develop the technical components of electronic prescriptions, the conformance framework, and the national change and adoption activities. Work on this project commenced in 2018, and significant effort was invested in developing the technical framework. So this technical framework has been co-designed with key stakeholders through the agency's electronic prescribing technical working group, and participants in these groups included representatives from the medical software industry, health professional peak bodies, consumers, and government. This technical framework details the requirements for software providers to make changes to their software products and ensures that software will be aligned with the electronic prescribing legislative framework, which ensures adherence to privacy and security principles and maintains patient choice. And Commonwealth level legislation changed on the 30th of October last year to recognise electronic prescriptions as a legal form, and further work is being done to align state and territory legislation to this as well. And of course, change and adoption activities is a very significant piece of this work to ensure that prescribers, dispensers, and ultimately consumers are aware of how electronic prescriptions will work and what they need to do to be prepared.
So here's a high-level view of electronic prescription implementation timeline, outlining the Australian Government's recent measures announced in response to COVID-19 and the long-term electronic prescription solution. So what's happening now? There are immediate options available for patients to receive medicines. Special arrangements have been put in place for prescribers to provide pharmacies with a clear digital image via fax, email or text message of a prescription for a patient who has had a telehealth consultation. Now, some of you may know this as image-based prescribing or the interim solution or prescriptions via telehealth. Now, this arrangement came into effect and is an interim solution only for use during the COVID-19 pandemic. Now, according to the latest Department of Health fact sheets, it's only current until September 30 this year. And it's also important to note that this is not the same thing as electronic prescriptions. Now, if you have any questions related to the interim measure, please refer to the Department of Health. And also the Pharmaceutical Society of Australia has a great resource on their website which breaks down the interim solution for prescriptions via telehealth, including specific legislation via the state and territories. And we've provided the link at the bottom of this slide as well. So from now on, the implementation of electronic prescriptions is being accelerated in response to COVID-19. So the token model will be available. So essentially, prescribers will be able to generate an electronic prescription, send it as a token, which includes a unique QR code, to the patient via SMS or email. And the pharmacist will be able to scan the QR code and download the prescription details. Now, this solution has been part of the electronic prescriptions plan for some time, but it has been accelerated. This token EP model or electronic prescription model is the focus of our presentation today. So April, I might have to get you to go to the next slide for me.
Yeah, sure, sorry.
All right, so what are electronic prescriptions? Electronic prescriptions are basically an option for patients to receive an electronic prescription as an alternative to a paper prescription. And the primary difference between an electronic prescription and a paper prescription is that the legal entity is the electronic document. Now, patients and prescribers will be able to choose between a paper or an electronic prescription. And it's important to remember that even with the introduction of the electronic prescriptions, the patient will always have a choice to have the paper script, as electronic prescriptions is not mandatory. Now, changes to the Commonwealth legislation commenced on the 31st of October 2019, recognising an electronic prescription as an alternative legal form by which medicines can be supplied under the Pharmaceutical Benefits Scheme. And states and territories are working on finalising details under this arrangement. So, electronic prescriptions are important because it provides a greater choice for patients, it improves efficiency in prescribing and dispensing medications, and it also may help reduce errors. It provides an opportunity to protect community members and healthcare providers from exposure to infectious diseases, and it supports digital health services such as telehealth services to ensure continuity of patient care. Now, this slide outlines everyone who can participate and use electronic prescriptions. So we've got prescribers, dispensers, software providers, and consumers, and they will all have a role to play. And of course, the consumer is at the centre of this, and they can choose to have a new prescription in an electronic prescription form. But there are a couple of things to note. So both prescribers and dispensers will require electronic prescription capability within their software to generate and dispense electronic prescriptions. And the patient must have an IHI, which is the individual healthcare identifier, to participate. An existing paper prescription cannot be converted into an electronic prescription. All right, so let's have a look at the two models of electronic prescriptions. The token model is being progressively rolled out now, and this token model, like I said previously, includes a unique QR code, and it is in evidence of a prescription, and it's not a legal document. It's really only the manner in which the electronic prescription is opened. So the patient can choose to receive this token via SMS or email. Now, April will go through some screenshots in a few slides' time that will help you visualise the end-to-end process. So that's from generating to dispensing electronic prescriptions. And importantly to note, each medication requires its own token. So that means that one token is issued for one medication. Now, the second option is the active script list. So following presentation of adequate identification, the dispenser can retrieve prescription details from a patient from the active script list. Now, this model will primarily overcome the issue of the lost token and be suitable for those patients on multiple medications. And it will also assist with medication management and adherence. So the active script list model is also useful when the subject of care is not able to receive and send tokens to the pharmacy. So they may have poor digital health literacy, might not have a mobile phone or a computer, and even no internet access. So for them, there will always be the option of a paper prescription. So as I stated before, the focus of electronic prescriptions in the short term will be the token model, which is on the left-hand side of your screens. And the active script list is the more complete solution and will be rolled out towards the end of this year. So I'd all encourage you to keep posting any questions you've got into the chat pane, and we'll be definitely taking some time at the end of the presentation today to answer those for you. All right, so now in this next section, we're going to go through a workflow that you may come across in practice. This electronic prescriptions case study follows a story of James. Now, he's a 72-year-old man who has an ongoing chronic condition and he needs a supply of his regular medication. Now, James's medical condition and age make him vulnerable to serious illnesses if he was to contract COVID-19. And James needs a new prescription, and so he has to make an appointment with his GP. Now, the GP practice that James goes to have all had some training and education on electronic prescriptions. So when James calls for his appointment, the front desk staff know to make sure that they update his contact details and validate his IHI number. So it's really important to make sure that the patient details are up to date. So when the electronic prescription token is sent to either the patient's email or SMS, they will be able to receive it. And also remember to validate your patient's IHI, as this is a core requirement of electronic prescriptions. So it's a good idea to make all your patients aware of electronic prescriptions and why you'll need to update their details. So this will not only make sure all your patient details are correct, it'll make it easier for when the patient is with the doctor. And it will also help you with those frequent patients. I remember trying to check the details of our regular patients who would say to me, "I'm always in here. You've already got my details. Nothing's changed." So this way you can let the patient know that you are getting ready for electronic prescriptions, and you need to make sure that all their details are correct so that they can receive the electronic script as a token if they choose. And in our practice, we would always try to encourage the patients to tell us their contact numbers and email, so they couldn't just say to me, "Yeah, that's right," with really out having to listen. So if possible, it would also be good for front desk staff to ask who the patient's regular or preferred pharmacy is, and then check if the pharmacy is enabled and can dispense electronic prescriptions. Then send a message to the doctor to let him or her know if the pharmacy is able to dispense the electronic prescription, as this will help the doctor when he talks to the patient about the script options. So, because if the pharmacy is not yet enabled for electronic prescriptions, the patient should receive a paper script instead. All right, so let's go back to James. He calls the practice to make an appointment. The receptionist checks his contact details and validates his IHI. She also explains about electronic prescriptions and how he can get scripts sent as a token to his phone as an SMS or an email. James provides her with his new mobile number and confirms the email address. The receptionist books a telehealth consultation with his GP and explains to James that this will help him to remain at home and avoid having to come into the clinic. The doctor conducts a telehealth consultation with James and discusses prescriptions options. James tells the doctor that the receptionist has explained about electronic prescriptions, updated his contact details, and was also going to contact the pharmacy to check that they could receive a token. And the doctor has received a message from reception to advise him that James's pharmacy is able to dispense an electronic script. The doctor then asks James if he would like a paper or an electronic prescription and lets him know that his pharmacy is able to dispense it. James, of course, says yes to the electronic prescription and chooses to receive the token via SMS. Almost instantly, James receives the SMS containing his token and he lets the doctor know. James is really happy that he won't actually have to come into the clinic to pick up the script. So when you have sent the token to your patient, it's really important to make sure that the patient confirms they have received it. So if the patient hasn't received it, you can either resend the token after confirming either the email or SMS details, or there are other options, and we will talk about that in more details as we go. So then James contacts his local pharmacy by phone to check if they have the medication in stock, and once confirmed, James forwards the SMS with his electronic prescription token to the pharmacy. The pharmacy is able to dispense the token for him by retrieving the details of the script from the script exchange. The pharmacy takes remote payment from James and then proceeds to deliver James's medication to his home. All right, so on this slide, I'm going to break down each of the steps for electronic prescription token model a bit further. There are actually various ways in which a workflow can occur, and that depends on a few factors. Now, I won't be able to go into every single sort of scenario, but I will try to explain a few options to help you understand how this will work in practice. So when the doctor is talking to the patient, they ask the patient if they would like an electronic prescription via the token model or a paper prescription. The prescriber at this point may check with the patient who is their regular or preferred pharmacy. Now, the reason being is the pharmacy that the patient goes to will need to have electronic prescriptions active and enabled in order to receive it via the token model. And another option, like in the case study, is when the receptionist is updating contact details, they could ask the patient who is their preferred pharmacy. And if they have time, they could call the pharmacy to check if they are able to receive the electronic prescription. let the patient's doctor know by sending through a message. Now, even though James will still have to ring and check to see if they've got his medication, it will be a great opportunity for the practice to start a list of electronic prescription-enabled pharmacy in their area for future reference. And we are continuing to work to get prescribers and dispensers to be enabled for electronic prescriptions. However, if the pharmacy is not able to receive and dispense a token, then the patient won't be able to get an electronic prescription token, as a token will not be able to be dispensed by the pharmacy who is not conformant for electronic prescriptions. Now remember that the token is just a key to unlock the electronic prescription. The token by itself is not actually a legal prescription. It's really just a key that has to be unlocked by the pharmacy, who will then be able to receive the script details and dispense it. So the token can be sent directly to the patient via SMS or email. To get it dispensed, the patient could visit the pharmacy in person and show the token on their smartphone for it to be scanned, or alternatively, they could SMS or email the token to their pharmacy of choice for them to process the prescription in that way. Now, once a pharmacy has received the token and dispensed the medication, they can either supply the medication in person or via home delivery, depending on the circumstances. Now, please note that there was an initiative announced by the Department of Health on the 11th of March, and it was called Home Medicine Service, which is available for people in home isolation and for vulnerable patient groups who wish to limit their potential exposure to the coronavirus in the community. For more information on the home medicine services, please visit the Department of Health website. So, what happens when the patient's prescription has repeats? The patient would receive an updated token to their mobile device via SMS or email. Now, since the original token has been dispensed, it then becomes invalid. And for future supplies, the patient must show the updated token that they had received for their repeat prescription. So if you sort of think about how medication is prescribed and dispensed currently using a paper prescription, the only difference is now that a patient can choose to have the script electronically instead of paper.
Okay, so this is now an example of what the doctor will see in the patient's clinical file when issuing an electronic prescription. But please keep in mind that this will obviously vary depending on the clinical information system used in your practice. So it's important to make sure that you check your software provider's website for more information, and keep an eye out for webinars being run by your software providers on electronic prescriptions so you can see what it looks like in your specific software. So here we have some examples of how an electronic prescription can be sent via the token model to the patient's phone. So on the left, you will see that it comes across as a regular text message, and it tells the patient that their electronic prescription token is available. The middle image there shows where the message has been opened. The patient can access the token via the link in the message. So it says tap to view your script. Finally, the image on the right is an example of the token, and you can see that there is some information about the medication displayed, such as the drug name. This helps the patient differentiate between tokens if they receive multiple electronic scripts. And they will receive one token per prescription, as we've mentioned before. But all of the prescription details won't be held in that view that you see on the right there. All of the complete prescription details is stored electronically. So it's stored in the prescription delivery service. And the pharmacist will have access to that once they scan and download the electronic prescription from that prescription delivery service. And again, it's really important that the doctor confirms with the patient that they have received the SMS or email before the consultation ends. And here are some examples of some different delivery methods of electronic prescriptions. So on the left is an example of how a patient would receive their electronic prescription as an email token. And on the right, we can see that that's an example of what the prescription will look like for a paper token as well. Okay, so in the pharmacy, the token's QR code is scanned for the patient's electronic prescription. Depending on the circumstances, this could be done by scanning the person's smartphone directly in store, or alternatively, if the patient is unable to come in store, the pharmacy can scan the QR code if they receive that QR code to the pharmacy's email address or an SMS system. It's worth noting that some pharmacies may not be able to receive electronic tokens via email or SMS. And as we're in the very early days of implementing these new features, however, we are working to ensure that adoption of this service reaches majority of community pharmacies in the near future. The pharmacy can then proceed to process this electronic prescription through their dispensing software and supply the medication to the patient. And just to reiterate, the token QR code can only be scanned and processed for a single prescription item once, and thereafter it would become invalid. If the prescription had repeats on it, the patient will receive a new token sent to their smartphone in the same method that it has been sent previously.
All right, so here we have some common scenarios that we've encountered going through in preparation and in the early stages. So in the first scenario, the patient deletes a token from their device.
So the first one here is the patient's unable to receive a token, so they might not have a smartphone. And we do understand that not all patients will have smartphones. So the patient, they can provide their carer's contact details to receive the token on their behalf, or alternatively, they can still choose to receive a paper prescription. It is completely up to the patient how they prefer to get their prescription, and your front desk staff could be encouraged when they're updating patient details and explaining electronic prescribing. So they could be encouraged to advise the patient that they can send the token to a carer or a family member if they wish to do so. And that's a good opportunity as well to update the carer information. But always keep in mind that the patient can choose a paper script if they prefer.
Sorry about that, April. I was a slide ahead. All right, so
That's
in
okay.
this second scenario, a token's not received by the patient. The patient may have given the incorrect contact details or even have had out-of-date information, and that resulted in the token being sent to the wrong number or even wrong email.
Yeah, so getting your staff to update patient details before they see the doctor can help alert to any errors and make any corrections as needed. To help avoid this, the doctor must confirm the receipt of the token before ending the consultation, or advise the patient to call back if they haven't got their phone close by to check. If the token still hasn't come through and the doctor is worried that it might have been sent to the wrong person, you will need to cancel the script and generate a new script with a new token, and obviously send this to the correct number with the amended details in the system. The original token will then become invalid and no one will have access to this medication or prescription details of that original cancelled token.
Okay, so then in the third scenario, what happens when a patient has repeats in their token or on their script?
Yeah, so in this case of an electronic prescription with repeats, the patient would receive a new token for a repeat prescription from their pharmacy. This token will be sent to their mobile device, again via SMS or email. And once the original token is dispensed, it then becomes invalid. So that when the patient's ready for their repeat, they will show the pharmacy the new token to have it dispensed. And as I mentioned before, the doctor can cancel a script, which then makes the token invalid. And we just have some examples of what the patient will see if the script has expired, or if it's already been dispensed, or if it's been cancelled by the doctor on the screen here. You may have noticed in these screenshots that there is no QR code on these images. So if the prescription does become invalid, the QR code won't actually appear because it's no longer valid. It will just display the relevant message. So here we have the prescription has expired, the prescription's already been dispensed, or the prescription has been ceased by the prescriber. And just a quick note that the appearance of these messages may differ depending on the prescription delivery service used.
All right, so some more scenarios. This is what happens when the patient deletes a token from their device.
And we all know how easy it can be for a patient to delete an SMS, and the first person to get the call would normally be reception. So your receptionist could send a note linking the patient's details to request the doctor to resend the token, making sure to note the number that it is to be resent to.
All right, and scenario 5, Are there safeguards to prevent patients using their token at multiple pharmacies?
Yes, so like I've mentioned before, once a token has been scanned and dispensed by a pharmacy, the token is then invalid and cannot be reused.
Great. All right, so number 6, will our software cater to legislative requirements of individual states and territories?
So software providers are working diligently on the specifics. However, practitioners are still obliged to ensure that they're compliant with legislation. So it is very important to keep up to date with legislation amendments to your relevant state and territories, and with your software provider as well, to make sure that they're implementing these changes.
All right, so another one, can you use safe scripts with electronic prescriptions?
There should be no change in how prescribers and dispensers use safe scripts with the introduction of electronic prescriptions. So this should be the same way that you use safe scripts with a paper prescription.
All right, and number 8 is, can we use electronic prescriptions for S8 medications?
This is a very common question that we get, and electronic prescriptions does accommodate the supply of Schedule 8 medicines. Pharmacists should dispense these medicines in accordance with their relevant state and territory drugs and poisons legislation, and legislation in Victoria is already in place, and Anglesea was the first area to successfully prescribe and dispense an electronic prescription.
And then what about electronic prescriptions for an authority script?
Yeah, so authority prescriptions can be generated and transmitted as electronic prescriptions. It is the responsibility of the individual practitioners to ensure that they're compliant with individual state and territory legislation, as well as federal requirements.
All right, so there are a number of communities of interest that are being established across Australia, and this is to ensure a smooth rollout of electronic prescriptions. And April's just mentioned this, but Australia's very first electronic prescription in primary care was successfully transmitted in Anglesea, Victoria on May 6th this year. Now, software providers are currently going through a product validation process, and then over the month of June, we expect to establish a number of these communities of interest, as there could be maybe 10 or more around Australia, and this is to ensure any technical or workflow issues can be addressed on a smaller scale. The broader rollout will take place as more software providers progress through their conformance testing. All right, so most of you are probably aware of the HPIO and HPAI, IHIs, the NASH, prescription delivery services, when you set yourself up for My Health Record. So I thought we'd just step through why you need each of these and what their roles are. So first up is the HI service. Now that's the Healthcare Identifiers. HI service is a national system for uniquely identifying healthcare providers and individuals. The HI service allocates 3 types of healthcare identifiers. Now the first one is the Individual Healthcare Identifier, IHI. Now this identifies the individual who receives the healthcare service. The HI service automatically assigns IHIs to every person who is enrolled in Medicare or registered with the Department of Veteran Affairs. Now, the next one is a Health Provider Identifier Individual, HPII. This number identifies the individual healthcare provider who provided the patient care, and that includes GPs, nurses, allied health professionals, specialists, dentists, and pharmacists. And in a minute, I'll cover how this relates to electronic prescriptions. And the third is the Healthcare Provider Identifier Organisation, HPIO. This number identifies the organisation that delivers the healthcare. So that's such as your general practice, pharmacy or hospital. And then the next one is, what is the NASH? The National Authentication Service for Health, NASH. Its role is to make it possible for healthcare providers and supporting organisations to securely access and exchange health information. Now, in September 2018, changes were made to the Health Identifiers HI service that allowed NASH PKI organisation certificates to be used to connect to the HI service. all NASH PKI organisation certificates requested and downloaded via Health Professionals Online Services, so HPOS, from the 18th of September 2018 could be used to connect to the HI service. Now, Medicare site certificates can still be used. However, these will be eventually replaced with NASH certificates to connect to the HI service by March 2022. All right, so the health identifier, HPAI, it's a unique number, and each one of your GP and nurses are allocated with a HPAI. Now, you would have entered those into the user details in your clinical information systems, and it's important to know that a provider will only be issued with one HPAI, and that's regardless of the number of qualifications they have or healthcare organisations they work for. Now, with a paper prescription, the prescriber put ink to paper and signed the script. With an electronic prescription, the HPAI authenticates the prescriber, much like a signature. All right, and then what we've got next is the prescription delivery service. A prescription delivery service, or PDS, provides a secure and safe electronic transfer of prescription information, and it is used by prescribers and dispensers. The electronic prescription is transmitted from the doctor's prescribing system to the prescription exchange in an encrypted format. It resides in the script exchange, which is ERX or MediSecure, until it is downloaded by the dispenser. So to summarise all the details of what you need in a nutshell to participate in e-prescriptions or electronic prescriptions, one, you need to be a registered organisation connected to the HI service. And remember, most of you already may have done this when you registered for the My Health Record system. And two, your doctors must have their HPAI, prescriber number, and prescribe the medication via the latest version of the clinical information software. And three, have installed to the latest prescription delivery service, such as ERX or MediSecure, and have made sure that all the prescriber's details have been updated with the prescription delivery service provider. Now, this is just a conformance register, and this information is available in the public domain. We will be maintaining the list, and as soon as newly conformance software becomes available, this reference will be updated. So please continue to refer to this list in the first instance. Now note, just because a software provider is listed on this web page as conformant does not necessarily mean that all their customers with the software product are enabled for electronic prescriptions and have started using the functionality. And users must ensure that they have followed specific directions of the software providers. Now, it's also vital to ensure both prescribers and dispensers continue to remain up to date and in close communication with their clinical peaks so that they are aware of what they need to do to ensure readiness for electronic prescriptions. And on this page, there is an attached link to the Australian Digital Health website that provides this information. And we also have a handy checklist. And as I said previously, the core requirement is that you be registered and connected to the HI service. Now, a simple check to see if you are connected to the HI service is if you can validate an IHI, you will know that you are connected and it is working. Now, I will note that some practices may have a prescription delivery service such as ERX or MediSecure installed, but not necessarily have them turned on or active. So it's really important to ensure that all of these functions are set up and working before you can begin electronic prescriptions. And the last step, of course, is you will need to upgrade your clinical software to enable the electronic functionality once it becomes available. Now, this is a progressive rollout, so you'll each need to stay in touch with your software providers to find out when this might be available for your software. And also keep in contact with your local pharmacies about yours and their readiness. Stay up to date with legislation amendments for your relevant states and territories, and also just check our website for more information and updates as they come through. Now on this screen, there are some useful resources that are currently available to ensure that you are well informed about electronic prescriptions. And once again, there is a link to the agency's website, which details information, and it's for both prescribers and dispensers. And it also includes some frequently asked questions, which are really great for you to go through, and the details of upcoming webinars, as well as some just general information on the topic. We've also included links to the Department of Health website and relevant fact sheets, along with links to the prescription delivery service software sites. Now, we do have some upcoming webinars for both prescribers and dispensers. And we've been doing quite a number of these over the time. And just in the month of April, the Digital Health Agency presented to more than 2,000 clinicians on electronic prescriptions. And we will be continuing these sessions throughout June. Now, on this slide, there are some upcoming webinars of electronic prescriptions, and we jointly run some webinars with some software providers. Now, we did do some with ZMed, which are available on their website, and we've also done a number of webinars with Best Practice, and I believe that they will make those available to their customers. But if your doctors are wanting to know about electronic prescriptions and what it means for them, I would definitely recommend that they attend the electronic prescriptions update for prescribers on the 23rd of this month. And also, the RACGP have an on-demand webinar available through June, and this will address multiple topics, and that includes the real-time prescription monitoring, electronic prescriptions, and also active ingredient prescribing. All right, so that wraps up our presentation tonight. Let's see what questions we have, and I'll hand back over now to you.
Hi, Nicola and April. A great presentation. Thank you very much. This is Yvonne back again. We do have a few questions. I think you've answered some of them, but I will ask them anyway, just to confirm. First question is, I would like to understand how the prescriptions are signed.
Okay, so the prescriptions, electronic prescriptions, the main difference, I suppose, between the electronic prescription and existing paper prescriptions is that it doesn't have that ink on paper signature. Instead of being physically signed, they are authenticated with the equivalent of an electronic signature. And the way that they do that is by using the certificates that we've mentioned in the slides, and also the connection to the HI service. So it uses that connection to the HI service to authenticate the prescriber with their HPII, and that digital authentication is the equivalent of the signature for the prescription.
Great, thank you. Now, before I go to the next question, just to remind everybody, we are recording this session, so you will be able to see, watch this session again once it's up on our webpage. So the next question is, and I think you've had a slide with this information, which software packages make the token prescriptions available now?
That's a good question, and what you can do is refer to your specific software products to determine what their capability is and where they are at in regards to implementation. The Digital Health Agency does have that conformance register, and that's publicly available on the electronic prescriptions website if you go to digitalhealth.gov.au. But that doesn't necessarily mean that the software is going to be completely functional. So each software has a different roadmap and a different rollout that will occur. So it's best to contact your software.
Great, thank you. Next one is, can electronic prescribing be used for methadone and Suboxone?
I'm not sure the answer to that one. Oh, you go, Nikki.
Yeah, so they are S8 medications, and sometimes the normal authority process will still apply to your area. And actually, the recommendation would be to check your the legislation relevant to your area. But we can take that on notice and provide you some more detailed information.
Right, thank you. And then we've got one from Petrina. Is the token model only available for telehealth consults?
So the token model. Oh, sorry. Sorry for interrupting you there, Nikki. The token model, it's available not only for telehealth consults, so it will be available for most prescriptions. It will be available for those patients who choose to have an electronic prescription, and when it's known that the pharmacy can accept it, and if your software is capable of prescribing an electronic prescription.
Thank you. Lots of good questions, and keep them coming. So again, there's another one here, and I think you answered this one again. As of now, what proportion of pharmacies in our area are electronic prescribing enabled?
So I don't think we've actually got a list of all of the pharmacies that are enabled, but I know when you're working in your practice, you obviously have pharmacies that are close by, and it's really important to keep in contact with them to make sure. And it's also really important that once you're enabled for electronic prescriptions, don't issue a token until you're sure that the pharmacy that your patient goes to is able to dispense that the token. And I know that there is going to be some resources available, that there'll be stickers and things on windows that you can see on pharmacies, but keep an eye, even keep up to date with your PHN, who'll be able to keep you up to date with that.
I think during the COVID-19, a lot of general practices have kept in contact with their pharmacies because we have had to do things a little bit differently. So I think just keeping up that communication between everybody, and it's a good quality improvement you can have in practice, just to check in with your pharmacies. Another question we have here is, will the pharmacist tell the patient how many repeats are left on their script?
So having a paper prescription and a token is no different. So on their repeat prescription, they could see how many repeats were left. And on the token, you will also see how many repeats are left. April, if you go back to the slide that shows the token model on there, and we'll be able to see that it actually does show, keep going back, the next, keep going. Yep. So on this one here, it will actually show when you have that how many repeats are available on that token. So you'll still be able to see. I don't know if you can see it on that, can you?
I think it says one supply remaining there.
Yeah, so one supply remaining. So it's very similar to what was on a paper script, only now you'll see that on the token.
So then another part of the question was, does the patient then send it back to have it activated? But once they'll just receive a new QR code for the next script.
That's absolutely correct, Yvonne. So each time that they dispense, so that token gets dispensed by the pharmacy, then that token becomes invalid and the pharmacy will issue a new token with a new repeat. Just in much the same way when they dispense that repeat. So if the repeat had 5-1 and they dispensed that, when they got it back, it had 5-2 on it, and that's what will show on they'll get a new token that will then say how many repeats remaining.
Fantastic. Another question is, with a repeat prescription, can the patient go to any pharmacy or do they have to go back to the same pharmacy?
So they can go to any pharmacy as long as that pharmacy is enabled for electronic prescriptions and are able to dispense that.
Great, thank you. And then Cecile asks, is there an additional charge from software companies in generating the scripts? Do we know?
At the moment, I believe the cost of the SMS message to the patient is being covered by the government, and that comes under that National Health Plan for COVID-19. So that is a measure that's in place till September, I believe, and then after this, it is best to talk to your software provider about what their roadmap is with charging for the SMS to be sent and how much it might be. So we're not quite sure what that looks like quite yet, but it will, at the moment, it is free of charge.
Great, thank you, April. And then I think lucky last we're on, can they use the token to a different pharmacy initially nominate? Oh no, we've already answered that one. Okay, another one. Here we go, hold on. If the patient does or receives their token, you said they can delay it and reissue a new one. Is the deletion process easy? So I assume is it easy for the GP to delete a token if they've sent the incorrect token? I think we want to ask there.
Yeah, so it is actually, depending on the software that you use, they will also provide you some information about that. But it is actually very easy. It'll be just basically either a right click and then cancel or resend. And that just depends on the software provider that you use, what that look and feel will be. But it is actually an easy process to do. And remembering that once that token is deleted, it wouldn't matter if they rescanned it, it will be invalid. They won't be able to use it. And as you saw before in the slides, when it's deleted, there is actually no QR code for them to see, but it is actually a very easy process.
Okay, great, thank you. And I do have another one. If a patient is taking oral contraceptives and skips periods, so will be due for a new script before token comes through, what happens then?
I'm not sure quite we understand that. Oh, yes, you go.
I was just going to say, electronic prescriptions have been designed to fit existing behaviours with how scripts are filled and the procedures around that. So I believe in that sort of scenario, whatever's happening now will still apply to electronic prescriptions.
So it's not an automated, it's not going to be an automated script. They'll still need to go back to the GP for further new prescription.
Exactly.
So
the repeat is sent to the patient whenever the new prescription's issued, so they'll be able to get that dispensed.
Perfect, perfect. And I don't think there's many others there. That looks like that's it. I think we've got everybody. I hope I haven't missed anyone. Do we give everyone? So we've finished nice and early. We've got another 25 odd minutes to go if anyone has anything. Okay, I've got Hugh. Maybe we can unmute Hugh. I'll see if we can do that in the background. Hello.
Can you hear me?
Yes, we can. Hello, good evening.
Yeah. Hugh Leslie, I'm a GP in the city. I have a question about the signing, which is one of the, I think, will be the first time that we're using the individual health identifier, the individual provider health identifiers, and sort of security and whether any thought or information is going to be provided around that. I have concerns, for instance, about having my individual health provider identifier, just on the network or in the system, which means that anybody can then purport to be me and sign referrals or prescriptions. Is there, does anyone know how the software providers are making that secure? Is anybody?
So Hugh, it's Nikki here. That's a great question. So basically, when we talk about your HPII and all those different services, so you've got, that is actually to identify you with that healthcare identifier service. I am not a GP, and so I don't have a HPII, and nor can I prescribe medication. And that's all done within your software currently. So you've got your clinical information system that in your user setup, all of your information's been added into there. And in order to send the script, you actually need to have a prescriber number, and you need to have all of those other details in there. And it's more for authenticating you in the back end, as opposed to
it's
your
a
number being
PKI certificate. Yeah, I understand. It's a PKI certificate which says that this is signed by me. So at the moment, I print a prescription and it's signed by me because I write my signature, and someone would have to forge that. But if the certificate is in my computer on the network, then anybody who uses my computer, who could, I think a lot of general practices are not sort of thinking about this or set up to do this, because anybody who logs onto my computer, passwords are often fairly generic, can prescribe, send a token to someone, and it's me. And I can't deny that it's me because that certificate says it's me. So I'm just wondering if anybody's thought about that, or has, if there's going to be some, what thought has been put into that, or because the HPIIs haven't been used in Australia to date. This will be the first time that they're used in any sort of serious way. And I think
they're great questions. Yvonne, you might actually be able to help this because I know that's one of the, for your practice support, to encourage passwords and those things.
Yes, I was waiting for that.
Well, I don't think passwords are enough. They're not enough for this, unfortunately.
Well, I think
GPs anyway. I mean, we'll have a talk at our practice, but I'm just wondering how people are thinking it's going to go forward.
Yeah, we can have a chat offline if you like, but we do really stress about security around all your systems. I know at the PHN we have encrypted passwords. We need to change our passwords quite often. We're not allowed to have a password more than, I think it's a month or so,
yes,
and then
but
they
medical
make us
director
change
doesn't
it.
let you do anything like that. Neither does EP.
So maybe that's something that needs
best practice
to
doesn't let you do anything like that.
Yeah. So, and I know a lot of practices do, do share
so I think GPs need to understand these keys. These keys are actually much more than the practice that we've just been using. The practice identifiers, which doesn't identify me, but these keys are actually, say in a non-repudiable way that this is me doing this action. So,
yes. Yeah,
that's
absolutely.
a much more serious thing, and it's medico-legally very important to understand that.
So, and that's probably the next thing is to sort of contact your medico-legal, and they would probably talk about the security and on passwords and what have you.
Yeah.
But
there needs to be a technical solution to this. That's all. And GPs need to understand that, and they need to be provided a good technical solution. Really, they probably should be carrying it on a key ring with them so that it's not available to anybody,
to anyone else,
for them to use.
So I suppose moving forward, that would be, something you could, like you said, raise in your practice for security wise.
Sure, we will definitely, but I think other people need to understand the same thing.
Need to have to think about it. Yeah.
PHN probably needs to understand that as well.
And definitely. Good question. Yeah, I agree. I mean, that is something we all need to have a think about. Let's take that on board and get back to you if we can. Thank you. And I do have a question, and I think Bo has their hand up. Maybe we can unmute them so they can ask. I know there was a question previously that said, can GP forward? Hello. Sorry for missing your question. Yes, we can.
Hello, can you hear me? Yeah, I'm still having the same question. Hello?
Oh, good. Hello. Yeah. So your question was, can GP forward token directly to pharmacy?
That's correct, yeah.
Okay, April?
Yeah, sure. So central to the design of electronic prescriptions is the important element of patient choice. So it's really important that the information you're keeping in your software product reflects the patient's contact details, so their email address and their phone number. So it wouldn't be appropriate to send a prescription through the token model, for example, directly to a pharmacy, because that is restricting the patient's choice. In the future, when the active script list model comes out, the pharmacy might gain access to the patient's active script list and then have a quicker view to their prescriptions and their active prescriptions. But with the token model, it's definitely not appropriate to send it directly to a pharmacy.
Okay. Does that answer your question?
Patient's happy for it to forward the script to the pharmacy?
Sorry, what was that?
Hello, if by agreement, if we ask the patient where they would like to go for the medication and they're happy to disclose that information to us, and it's not always the same pharmacy that they use.
That's a good point. Nikki, would you know about that?
Yes, I do. It's still actually up to the patient, and that is why we're sort of saying it's really important. And as April mentioned, the active script list, it'll be a more complete solution And that will enable those patients with multiple medications to be able to get that from their pharmacy directly. And I know that previously that pharmacies often kept repeats at the stores for their patients so they didn't lose them, where the token model will just sit on their phone. So it is really recommended that the pharmacy your doctor does not send directly to the pharmacy, that the patient actually does have that choice. Where there is a script owing, for example, the software will enable each individual software. I'm not sure what it will look like in each different one, but some of them that we have seen do allow for the script owing to be sent directly to the pharmacy because that's a different circumstance.
Okay, thank you. I hope that answered your question. So do we have any more? Here we go. HPIIs are being used to identify providers when uploading information to My Health Record. So I don't know if that's a question or a statement from Renata. If you're there, Renata, if you pop your hand up, if you wanted to elaborate on that a little bit.
That is correct.
Okay. And that's it, I think. I don't have any more questions. If anyone else has got their hand up, always got anything else for us? Are we happy with that? I hope I haven't missed anybody. Please send your questions through if I have missed any questions. We did get a few through. We had a couple of repeats. I'm trying not to repeat the questions. I hope we've all enjoyed the evening. April and Nicola, is there anything you want to close off with? If there's any other information you think that we need to know, or we're done?
Oh, thank you very much for having us.
Thank you.
Thank you. Thank you very much. Have a nice evening, everyone. Keep warm. Send any questions you may have. There will be a recording sent to you after this session. There's also a quick survey if you could take time just to complete it for us so we can improve what we provide for you. Thank you very much. Good night, everybody.